Okay, let's talk about something that's on a lot of people's minds. If you're pregnant, getting sick can be extra stressful. You're wondering what medications are actually safe to take. Well, today, we're going to dive right into that, using our source material to get a clear picture of antibiotics and antivirals during pregnancy. Let's get right to it.
So this is the big question, isn't it? It can bring up a ton of anxiety. You're feeling awful, but your number one priority is, of course, the health of your baby. So how in the world do you make the right call? Well, our source material is actually really helpful in separating the safe bets from the potential risks.
All right, let's kick things off with the good news. The source material points to several types of medication that are generally seen as safe to use during pregnancy. Think of this as your green light list. So what's on this list? Well, we've got some familiar names in the antibiotic world like penicillins and cephalosporins, which, are often used for all sorts of common bacterial infections. The source also gives a thumbs up to macrolides, another kind of antibiotic. And when we look at antivirals for treating viruses, nelfinavir is the one that's identified as a safe option. But for every safe option, there's always the other side of the coin. It is just as important, maybe even more important, to know which medications might carry risks. This is what helps you and your doctor make the most informed decisions. This is the warning list. And now, let's be clear. The whole point of this next list isn't to freak you out, not at all. It's to give you the knowledge you need. This is the info from our source that you can bring right into the conversation with your healthcare provider, so you can work together for the best possible outcome for you and your baby. And you can see right away, this list is definitely longer. It has several major antibiotic types, like tetracyclines, which are often used for things like acne, and also fluoroquinolones. The source also puts a red flag on a pretty significant number of antivirals, like rimantadine, lamivudine, and lopinavir, flagging them as unsafe during pregnancy. Now, here's something really interesting. The source material singled out one drug for a special shout-out, efavirenz. It was literally the only one flagged with the word unsafe in all capital letters. That really suggests it carries a particularly high risk that you absolutely have to pay attention to. But it's not just about a drug's direct effect on its own. We also have to think about how different medications can interact with each other. And our source pulled out one specific interaction that is just, it's critical to understand. So this is a direct and really powerful quote from the source material. It says, the antiviral drug delavirdine interacts with OCP's contraceptives. This is especially a cause of pregnancy for mothers with HIV. Wow. So what does that actually mean in the real world? Let's break it down. This slide really clarifies that chain of risk. It's a simple but pretty dangerous sequence. Someone takes the antiviral delavirdine. That drug can then mess with their birth control pill, making it less effective. And the result? A significant risk of an unintended pregnancy, which, as the source points out, is a major, major concern. Okay, so we've looked at the safe list, we've gone through the warning list, and we've highlighted a really critical drug interaction. All of this information, it all points to one single, absolutely non-negotiable conclusion. And here it is. This is the most important thing to remember. This whole breakdown is a tool for education. It is not a replacement for medical advice. These lists, these warnings, they're all designed to help you have a smarter, more informed conversation with your doctor. They are the ultimate authority on what's right for your specific health situation. So we're going to leave you with this question. Don't think of this information as a bunch of rigid rules, but as a starting point. It's a way to start a dialogue. Because when you're informed, you become the best possible advocate for your own health and for the health of your baby. Thanks for tuning in.